There were 4 new cases in the community today, all of them linked to previous cases and were already quarantined. 5 other cases today were imported, 2 being returning Singaporeans or PRs. Now more details will be released tonight. More Covid-19 testing operations are underway in the Bukit Merah and Red Hill areas today. This follows the Health Ministry's announcement last night that 4 residents from 3 households in Block 103 Henderson Crescent tested positive. Testing is conducted in the pavilion at 104B Henderson Crescent today and tomorrow between 9 a.m. and 4 p.m. Meanwhile, about a 12-minute walk away, another swabbing operation is also underway at Lengkok Bahru. MOH said last night that viral fragments were detected in wastewater samples from blocks 55, 56 and 57. Investigations are ongoing to determine linkages and the source of transmission. Testing is compulsory for all residents, shop owners and staff there. As at last night, there are 12 cases linked to the Henderson Crescent cluster and 91 to the Bukit Merah View 1. For a closer look, I'm joined by Professor Dale Fisher, an infectious diseases expert from the National University of Singapore's Yong School of Medicine. Now, Professor also chairs the National Infection Prevention and Control Committee. Welcome back to the show, Professor. Let's talk about the largest cluster in Singapore, the 115 Bukit Merah View Market and Food Centre. It has over 90 cases. Now, comparing with the other clusters that we've seen, Professor, so far, like the one at Changi Airport and GEM Westgate, what does this cluster tell us?
Thanks, Haryanto. I think what it tells us is that these clusters are getting harder to control. I think in times gone by, this could have been controlled with conventional sort of contact tracing, quarantining of contacts, isolating of contacts, isolating of cases, sorry. But now what we're seeing is with this Delta variant that it's obviously a lot more infective, and there's good evidence, good epidemiologic evidence for that. But it's also confounded by the fact that vaccinated people have very mild or asymptomatic disease. So what you can do is get an asymptomatic person, maybe unrecognized, could give it to somebody else, and then it appears, and now it's a new cluster because it's not sort of linked. So what we're seeing with these new clusters appearing apparently out of the blue, and in fact unlinked cases on a daily basis, we didn't see these before, but that's because of these different factors such as the Delta variant, and also the fact that we've got a good percentage of the population vaccinated. It's kind of a good problem, actually, Haryanto. But what we can do is we can also see what the future is going to look like, and that is that transmission will be largely silent through the community or have mild disease, and really only the unvaccinated people will be the ones getting sick.
Right. Professor, daily case numbers in the community, now recently those stabilizing, have remained in the low double digits, and there continues to be unlinked cases among them, like you mentioned earlier on as well. Will we see these numbers eventually dipping with more mass testing exercises being carried out to sieve out and ring-fence possible infections?
Yeah, I don't. You see, we could make all the cases go away. We could have another lockdown or circuit breaker or whatever, really increase those social restrictions. But that's not the direction we want to go. That's just not fair on people's businesses and weddings and all these types of things. So we want to be able to open up. Now, that will be enabled by vaccination eventually, but actually we're not there yet. So we're trying to balance this controlling the disease without increasing the social restrictions while we, if you like, race to that endpoint by getting everybody vaccinated. So contact tracing, because of the unlinked cases, you can see contact tracing can get many of the cases, some days most of the cases, but actually not all of the cases. So I don't think it'll go away without increased social restrictions, and nobody wants that. So I think if we rumble along like this as we keep getting vaccinated, that has to be the strategy.
So Prof, are you saying then that these are numbers that Singapore can expect moving forward?
Yeah, and until we stop counting them, I think it's quite likely because as I said, there's so many silent cases, and then new clusters can appear. There's so many unlinked cases and people diagnosed that weren't actually in quarantine. So therefore, you can presume there's been some more spread of this Delta variant. So I think we can expect to see these types of numbers. And as has been mentioned, we'll be tracking the more severe cases because they'll actually be the one that matters. We'll eventually get sick of just counting, another dozen asymptomatic people, because even if and when they spread it, if they spread it to more vaccinated people, then those people aren't going to get sick either. Let me just tell you, in the last 2 months, there's been about 900 cases of COVID diagnosed. Now, 70 of those people became sick and 6 have died. But let me tell you, of the nearly 200 that were vaccinated, only 2 of them needed oxygen. None of them went to ICU and none died. All the deaths and almost all of the sick people, and certainly all the ICU patients, were not fully vaccinated. The evidence is clear from the trials. It's clear from our Singapore data now that it's frankly becoming irresponsible not to be vaccinated, because we can see the disease is going to become endemic. It's going to spread. If you're not vaccinated, you're just taking a risk.
All right. Looking forward, Singapore is preparing to live with COVID-19 as an endemic disease, and that will include doing away with massive contact tracing and, like you mentioned as well, tracking only hospitalized cases or just the severe cases. So, Professor, when and how would that shift take place?
So, yeah, eventually we will have to let it run in the community. But we certainly want to see most people vaccinated. I don't think herd immunity is what it's all about. It's more about giving people the opportunity to protect themselves, because we know vaccinated people can still get the disease and can still spread the disease. So we're not actually stopping transmission completely. I think it could happen by the end of the year. I think there'll be steps. I think the government will, they're not just going to say one day it's over, let's let it run. It'll be less mask wearing, perhaps less mask wearing outside. Maybe we'll open the borders for people that are vaccinated. They can do less quarantine, things like that. So I think it'll be gradual, but I think we're going to see potentially see some exciting things over the next 6 months.